All right, while everybody's joining, I'll go ahead and do a little brief introduction. I am Kat. I am a doctor of physical therapy. Oop, see here. I am a doctor of physical therapy, and I also have specialty training in pelvic and obstetric physical therapy, meaning anything pelvic health or constipation or any sort of pregnancy postpartum thing is my jam. So that is what I specialize in. So a little bit of a background. While we're waiting to join here. If you want, if you're having a hard time seeing the PowerPoint, you can change the view if you go to the top and make it at 50% so that you can see the PowerPoint. And that might make it a little easier to see all the information that's upcoming. So yeah, just a little bit about me. My husband and I just moved back to Florida in August from Chicago, and I am pretty jealous today because they got a huge snowstorm. I love snow, but I am also really happy to be back in Florida, where it's actually sunshine. I can step outside and there's sunshine there. So, but when I was in Chicago, I was working for a major hospital system there called the Shirley Ryan Ability Lab, and what was great about it is where a lot of the research is getting pumped out of her physical therapy. So I got to see crazy complex cases and also had access to the latest and greatest. So everything you'll get with me is kind of what's the most, up to date things and the most latest research on all the stuff from at least a pelvic health perspective. Um, so that's a little bit of my professional background. I opened Rhythm Pelvic Health also recently, and we opened in November. So we are having a great time helping individuals with these conditions. Constipation is one of my favorite things to treat. I love it. I have also struggled with it myself, which is not why I love, treating individuals with constipation actually, but I just think there's so much that we can do here. So I hope you guys find this helpful. Kind of the outline of the webinar is going to be, we're going to talk a little bit about kind of what even constipation is. And then we're going to also go into a little bit of some exercises that we can do, some relaxation exercises, and we're going to kind of go through some things that you can do to help with constipation. I just have to kind of say from the get-go that this is not medical advice. This is not personal to you. Kind of take it as you can, apply it as you can, see what works for you. Okay. You guys ready to get going? I know I am. All right. There is a chat too. There is a little bit of time at the end for Q&A. So we can put your questions in the chat and I'll get to those at the end, okay? Awesome. All right. So let's do some quick facts about constipation. So constipation affects 1 in 5 individuals. So it is so common, is very, very, very prevalent in our population. I'm sure many of us can relate that we know individuals who struggle with this. Women are 2 to 3 times more likely to have constipation than men. So that is kind of crazy to me, but it is what it is. So we are, if you're a female, you're a little bit more likely to have constipation. And there's also actually 4 different types of constipation, which is kind of mind blowing, but there's different types. So the 4 types, just really quickly, of constipation. Functional constipation is the most common. That's what we're going to talk a lot about today. Structural constipation is another where maybe you have an obstruction due to maybe a prolapse. Secondary constipation is typically due to another disease, including a spinal cord injury or a stroke. A lot of times constipation can be secondary to that. Then IBS-C is a form of IBS, including constipation, where you usually, the only kind of big difference of that and functional constipation is typically you have a lot of abdominal pain. And then once you have your bowel movement, you feel a lot better. And you typically kind of alter between having diarrhea and constipation with IBS. All right, so to kind of rule in that you've had constipation, so there's a little bit of a kind of classification to really say, yes, you're constipated from some of our guidelines and our research. So usually the time frame is about 3 months of experiencing these symptoms, and you need to have at least 2 of the following to really be considered constipated. So one of them is having fewer than 3 bowel movements per week. So 1 or 2 bowel movements per week is considered abnormal from a constipation standpoint. Straining for at least 25% of your poops. So if you poop 4 times that week, you strain 1 time, that is a factor that would consider possibly constipated. Having lumpy or hard poop, 25% of the time, that is also another indicator that you might be having some constipation. So like I said, 4 poops, if one time is lumpy or hard, that is an indication. If you have that sensation that you didn't fully empty at least 25% of the time, that can actually be a really common indicator of constipation. And if you have to use manual maneuvers, which some people will report they need to like use their finger to fully empty or do some sort of kind of contortions or some things to be able to fully empty, that is actually a way that you can know that you're constipated. So if you hit off any of these 2 things or more of the following within a 3-month period or greater, you are considered to have chronic or constipation. All right, so this is, I get a lot of questions like, what can I do to help? And we're gonna talk about some of these things, but I want you to know that constipation is so multifactorial. So, and there's so many things that are unique to you. So these are just kind of a general list, and there's a lot more things that are kind of in sort of that can affect the GI system. But diet, which we all know, and I promise I won't going to tell you like to preach that diet is the #1 thing. There are so many other things that involve in this, and many people with constipation like are so sick of hearing diet stuff, but it is a big factor of why you are constipated. Your activity level, how much you exercise, how often you exercise has a bit to do with your constipation. Your fluid intake, your muscle function, which is what we're going to talk about, and your pelvic floor muscles, how they work when you're having a bowel movement. Your stress, anxiety, depression, any sort of mental health has a big piece in constipation. Your age and your sensory system, how our body has been trained to feel urgencies, and many more things. So constipation is a very complex condition. There are so many things that impact that system. So we can't just address one piece of it. All right, so how is the pelvic floor related? So it's related in many ways, but really the most famous way that people have heard of why it's related is because of the pelvic floor muscles and these things called stretch receptors. So I'm gonna grab the anatomy model, my favorite. I still haven't named it yet. I can't choose which name. So maybe in the Q&A, you guys can send me some name suggestions again. But okay, so here is our pelvic model, right? Just so to reorient ourselves, let me see if I can back this up. So our pelvis has all these muscles inside our body. So everything in red, these are muscles. These are your pelvic floor muscles, okay? And I'm gonna kind of zoom in right here on the rectum, and this is our external anal sphincter muscle. And then these are the deeper pelvic floor muscles here. And I'm gonna kind of show you how this is the rectum. The rectum directly sits inside the pelvic floor. So there are these things called stretch receptors inside your rectum that also has connections with our pelvic floor muscles that are responsible for your body feeling the urge to poop. So kind of how it works is your body produces stool. It makes its way down through your colon and all the stuff, and it comes into the rectum and it stretches the rectum. When the rectum is stretched to a certain extent, the receptors get activated and they send a message to your brain saying, hey, I gotta poop. And then you in turn feel the urge to poop. Now, the muscles also have a big piece of a puzzle with that feeling that urgency to poop. Also, during a bowel movement, your pelvic floor muscles have to relax. That is their job. That's how poop comes out, is these pelvic floor muscles, especially that anal sphincter, and what's the deeper pelvic floor muscles, one that's called the puborectalis. I won't bore you with all the anatomy, but it's gonna kind of come up later when we talk about positioning. But those muscles must relax when we have a bowel movement. So as a pelvic floor therapist, I commonly see people doing the opposite. When they try to poop, their muscles are contracting, and that's why they can't get it out, because their muscles are not coordinating properly. So sometimes it's an urgency problem, sometimes it's a coordination problem, oftentimes it's both. So the pelvic floor has a huge piece to do with being able to empty fully. Okay, so we're gonna take a break, some boring information, and we're gonna do an exercise. So when I said the pelvic floor must relax when we're having a bowel movement, I'm going to kind of teach you how to relax your pelvic floor muscle. Now, it's really tough on Zoom, so just do your best. If you don't feel it, don't worry. We can kind of chat through it. We can work through it together. But the best way to relax your pelvic floor muscle is actually through a technique called diaphragmatic breathing. I don't know if you've heard of this before, but I'm going to teach you how to do it. And we're also, once we learn how to do it, then we're going to try to see if we can feel our pelvic floor muscles relax during that exercise. So if you're sitting or wherever you're doing, if you're standing, take a seat. I'm going to back up a little bit. I want you to go ahead. Let's see. All right. I want you to take your hands and I want you to bring your hands to the outside of your ribs. Okay. Now you got your hands there. I want you to go ahead and just feel the space below your belly button. A lot of times our pants button in that area or our pants tie there, that kind of space below, right above your pubic bone and below your belly button. So we have our hands on our ribs. We're aware of that space there. I want you to take a deep breath in through your nose. Try to think as you breathe in for your ribs to go out and your belly to go out at the same time. So ready? Let's take a deep breath in through our nose. Breathe in and out. So let's do like 3 or 4 of those just to practice. So take a deep breath in and out. Think about those ribs going out as you breathe in and out. And see if you can get that breath into that lower belly and in the ribs at the same time. Breathe in and out. So what we don't want to see is using your chest going or our neck muscles to breathe. We really want to get it into this area in our lower abdomen. So we want to take a breath in, everything expands and out. Okay, are you ready to learn about the pelvic floor piece? Because that's already confusing enough. So I want you to think about the same positioning. Now, can you feel your sit bones sitting on the chair? Those are your 2 bones that you sit on. Can you feel those? Cool. Now, I want you to think about your rectum. Can you feel your rectum in between your sit bones? And I want you to close your eyes and I want you to feel those different locations that I just discussed, the sit bones and the rectum. Take that same breath in and out. And what you should feel is almost a downward kind of movement of the pelvic area. It's really subtle. So as you breathe in, if you want to close your eyes, it makes it a little easier. As you breathe in, you should feel expansion down in that lower pelvic region. If you don't feel it, it's really, really hard to feel. It can be really confusing, so don't worry. But I promise you, if you're doing that deep breath breathing, you are relaxing your pelvic floor muscle. So I want you to, you can practice as many of those as you'd like. We're gonna get to that in a little bit. We're gonna practice again towards the end of this webinar. But I want you to picture, so we have this muscle called our diaphragm. It sits underneath your rib cage and it's actually like a dome, just like your pelvic floor muscle are domes down here. So when you breathe in, your diaphragm actually drops down. And when that diaphragm drops down, it actually increases pressure in your abdomen. And when that happens, it kind of forces your pelvic floor muscles to lengthen. So when we do that type of breathing, we're using pressure to help stretch and relax our pelvic floor muscles. So diaphragmatic breathing is the best way to relax your pelvic floor. And it's really important during bowel movements, which we're gonna go through at the end of the webinar. Cool? All right, so let's move on for a second and we'll get back to that stuff. Okay, so what can you do to help, at least from a pelvic floor perspective? There is a lot of things, and we are gonna break all of these things down. So we're gonna kind of go one by one through them, and at the end, we'll kind of wrap it all up together. So your reflexes. We have wonderful reflexes in our body and we want to use them to our advantage. One of the main reflexes of your GI system is called your gastrocolic reflex. And it is the reflex that helps things move and groove and keep things moving in the lower abdominal and lower colon and tract. So this reflex is the most active in the morning and then after meals. So we want to use that time and when our body is doing its natural thing with our GI system to use that to our advantage when we are trying to go to have bowel movements when we're dealing with constipation. So we're going to talk about a bowel routine in a few and how we can use that reflex to really get things moving and grooving. And so in the morning and after meal times is when this reflex kind of starts moving food through our lower GI tract. So there's another thing called your colon massage. So I'm going to teach you on the next slide how to do a colon massage. So it's a little bit of a technique that we massage our abdomen to help with any sort of constipation, gas feelings, abdominal bloating, etc. So colon massage. Now, our colon is a very important part of our GI tract. I'm going to back up again because I'm going to show you how to do a colon massage. A lot of times this is easiest laying down, but you don't have to lay down right now. But briefly, our colon, we have what's called our ascending colon here, our transverse colon here, our descending colon here, and then that goes into what's called our sigmoid colon and our rectum. I will not bore you on the anatomy of that, but I want you to just see that our colon goes up and around like a U. Okay, like an upside down U. So we can actually do massages along our GI tract like this to help stimulate that gastrocolic reflex and also help stimulate the gut to move. So what we do, I usually have you bring like two of your hands stacked on top of each other. And you see on the picture on your right lower abdomen, kind of next to your that bone in the front of your hip, that's kind of where that colon starts. So you're gonna want to bring your hands there and you're gonna do small little clockwise circles about maybe 3, 5, or wherever you kind of get over it, you're done at that spot. And just kind of do some clockwise circles. Sometimes this is pretty tender, okay? So you're gonna do that for whatever feels good, and then you're gonna slowly move up the colon. And you're just gonna do clockwise circles and move on up. And this is a really great technique if you are struggling, feeling like you can't poop, or you really wanna go, you feel you have to go, but it won't come out. Really trying to work on massaging that colon, stimulate the gut to move. Keep going. You can go back and forward. There's a few other techniques, but this one's kind of my favorite. So it's kind of good to do when you're lying down. So this is a colon massage, and you go all the way down to your left bone in the front of your hip, kind of that soft spot in between. And you can repeat that for like 3 to 5 minutes, as many times as it feels kind of good. And like I said, this is to help stimulate the gut motility. So if you're bloated, feeling like you really need to go, doing this massage can really, really, really help. And it's also helpful to do like in the morning, at night, whenever after meals and things too, to also try to kick your GI system into gear. I love colon massage. Okay, so another way to retrain our nervous system is through a bowel routine. So our bowel routine is a routine that we can do to reset our GI system. The nice thing about your gut is that it loves routine. It loves to do the same thing over and over and over again. And so if you can train it to do that, it really, really thrives in a routine environment. I don't know if you've ever heard, but our gut is considered our second brain sometimes, and it actually can be trained, just like we say a brain can be trained and taught to have bowel movements at certain times throughout the day. So I recently just talked about the gastrocolic reflex, and it's the most active in the morning. So I typically like to do your bowel routine in the morning, just because I'm like, let's use all the tools that we can to try to get the system regulated. But you can also do this, after meal times, etc. But what I want you to do in the morning, I want you to wake up, drink something warm, sometimes a warm lemon water, a coffee, just warm water, tea, whatever you'd like. You can eat a little something. And then about 20 to 30 minutes later, I want you to go sit and try to have a bowel movement. This is to practice. So you likely when you're first doing this, you won't have one. And it's okay if you don't. This is to start to encourage our bowel system that this is when I go to the bathroom. So what you want to do is that 20 to 30 minutes, you want to go to the bathroom, and I just want you to sit there and relax. Practice that really deep breathing. Do not strain, and do not sit on the toilet for longer than 10 minutes. This also applies for when you're having other bowel movements. 10 minutes max. Do not sit longer than that, okay? If it's not there, get up, come back when it's there, okay? So we want to feel that, to really train that urge to happen. Also, eating meals similar times throughout the day really helps keep this on track in your bowel routine. So if you are somebody that like Monday, you forgot that to even eat lunch, and then like a huge dinner, the next day you're like perfect, you have breakfast, lunch, dinner, snacks. That's really confusing for your GI system. So if you can try to like, you don't have to be super rigid, but try at least around the same general times throughout the day to eat meals, kind of let your GI system create that routine. Last kind of thing about urges, you do not want to ignore the urge to poop. So a lot of times with urinary retraining, we teach you to kind of ignore the urge. With bowel movements, you never want to ignore the urge to have a bowel movement. Now, obviously there's situations where you can't. A lot of times the urgency stuff has been developed since you were a child. A lot of people were like either fearful to go poop in like a public restroom somewhere, so they would hold it all day till they got home. Or a lot of times people don't want to poop in public restrooms, or they're afraid they're at work and stuff, or maybe it's really painful to have a bowel movement, so you kind of hold off that urge. So I'm here to tell you, if you feel the urge to poop, go to the bathroom. That is the best thing that you can do. Obviously, there are certain times that you might have to hold it, but those should be infrequent. It should be frequently emptying when you feel that urge. Okay, so that's it for bowel routine. So just as a nutshell, you want to wake up in the morning, drink something warm, eat a little something. 20, 30 minutes later, try to go sit there. If you don't poop, it's fine. That's just to practice. Eventually, you should start emptying in this routine. And don't sit there longer than 10 minutes. Practice really nice breathing. Don't strain. Okay. So that's a bowel routine and it works. It's amazing. And we're jealous of all those people who are like, have a bowel movement every morning. If you do this, that could be you. Okay, fiber and water. I am not a dietitian, so I do not get all into all the fiber, water, diet stuff, but we do get into the general recommendations from the American Dietetics Association. So in general, women should get about 20 to 25 grams of fiber per day, men 35 to 38 grams per day. That's what some of the research says. If you are not getting this much fiber, you do not all of a sudden want to just start cranking your body with fiber. You will be bloated and uncomfortable and it will not feel great. So if you do need to increase your fiber, I recommend doing so very gradually, like add a few grams a week, very, very mildly, so you don't have some adverse effects to that. Fiber is a very complex kind of system in itself. I am not the biggest fan of fiber supplements. I really think that we can get there with our food, but sometimes we just can't. If you don't know how much fiber you're getting in, the MyFitnessPal app is free. If you track your diet for like a week or even like a day or two, you can actually see how many grams of fiber that you're getting in. And that's a really good way, because this can be really hard to be like, okay, and a lot of foods that, like, I know a lot of people think have tons of fiber. It's not that it doesn't have fiber, but it's not getting you to that 20 to 25 grams. Now, when we talk about fiber, though, we also have to talk about water. So poop in the way your poop kind of is formed has a very, very extensive process, but fiber and water really keeps that balance. So our recommendations from a pelvic floor physical therapy standpoint, they have us recommend that you get half of your body weight in fluid ounces of water per day, which is, I know people are like, no way, lady, like not happening. Other research also suggests that 6 to 8 glasses that many of us have heard. I would say at a minimum 6 to 8 glasses of water per day. Get it in, try not to chug it, sip it gradually throughout the day. It is so good for your GI system. So a lot of people, they are like, I eat so much fiber, Kat, I don't understand. But I look at their water intake and they're constipated because they're actually eating way too much fiber, not enough water, and that is clogging their system up. So we really got to find that fine balance. Another little caveat, if you are not drinking this much water, don't all of a sudden just start drinking like a gazillion ounces of water a day. Slowly add water to your system. It'll help it adapt more easily without as many adverse side effects. Okay. So I should have warned you. I'm going to show you a picture of poop. And I know this always takes people back, like, oh my gosh, lady. Okay. So this is called the Bristol stool chart. So our poop, what our poop looks like, really can tell us a lot about what our body is needing. So I want you to look in the toilet. A lot of people get in the habit, like, I just want to flush it. This is gross. I don't want to look, but I'm going to challenge you to look. Okay. Because it really tells you what your body might be needing in a general point. Okay. So what we call the money poops, or the ones that we're searching for, are type 3 and type 4. I joke and I say like a ripe banana, okay? Soft and formed, not too hard and not too loose. So we're looking for that really, really good consistency. And this is huge with constipation. Many of my patients with constipation have a type 1 or type 2. And type 1 and type 2 typically indicate that you're not getting enough water. Sometimes you're getting too much fiber and not enough water, also is the case, but typically that's a water issue. Type 6 and 7, typically that's a fiber issue. We want to be right in the middle, and I call those the money poops. So look at your stool, see what it looks like, see if it's in that type 3, 4, and adjust your diet and water intake as kind of needed. Sorry, I didn't warn you about that, I know. Okay, so we're going to talk about posture. So this is another reason that pelvic health is super related to having bowel movement. So the way that you're sitting when you're having a bowel movement has a ton to do with your ability to empty. So this picture that you see here of this woman on the toilet, she has her feet on a stool, her knees are above her hips, and this is actually the anatomical position that we are supposed to poop in. A lot of times, like many countries, third world countries, especially when they don't have the fancy toilets that we have, they will squat over a hole, quite literally, and that is actually correct. You are supposed to be in a squatted position, knee above hips when you're having a bowel movement. That, what it does is relax the pelvic floor. So I'm going to kind of show you with the rectum. Where did my rectum go? Okay. So do you see how this is like a little bit of a kink here? This is called your anorectal angle. This angle is really important with being able to completely empty. So if we poop in our standard position where our hips are above our knees, Basically, your rectum is kinked off. So getting our knees above our hips actually straightens out this angle and allows your stool to empty. I know many of us have seen the squatty potty, that kind of commercial. It is those people are making millions off pure anatomy. Okay, so the anatomy of the rectum, when we're in that position, it allows your rectum to be in a straight line and allows the pelvic floor muscles to relax and for you to have an easier time emptying. So when you are on the toilet, I really suggest trying to get your knees above your hips. You don't have to get a squatty potty. You don't have to do anything fancy if you don't want. What I recommend doing, if you have a trash can in your bathroom, flip the trash can over on the side, put your feet up on it, and have a bowel movement. See how that feels for you. There's various heights that feel different comfort levels for different people. So find what works for you. Some people have books. I have them put their feet up on books to try it out, see if they like it. And if so, order a squatty potty. Those things rock and they really, really, really help with constipation. And it's just because of the anatomy. So try to think about it from that standpoint. Now, when we're on the toilet, we're going to talk about breathing in this great posture. So we did that breathing exercise earlier. So breathing is so important. How many of us are guilty of going and pushing downwards, closing our throat off, pushing it with all our might, trying to get things out? That is very, very, very strenuous on your pelvic floor muscles. And actually, our body's trained to react to high increases in pressure. So, usually, what happens is our pelvic floor muscles tighten right up because that downward, really intense pressure, they're like, hold on, I got to support my body here. So, you're kind of working against a system that the pressure is just not optimal. So, breathing with your mouth being open, exhaling like you're fogging a mirror, maybe you're blowing a windmill or a balloon or birthday candles. Blowing out as you try to push downwards can be really, really nice to your pelvic floor. So do not hold your breath, do not close off your throat and try to strain it out. That is very, very harsh on your pelvic floor muscles and likely will lead to incomplete emptying, straining, pain, etc. So try to do your best to think about breathing. So let's try that breath one more time. I want you to take a deep breath in. Try to feel everything kind of expand. And then as you exhale, maybe act like you're going to blow out some candles. You might feel how the rectum moves downwards a little bit. That is what we want. So during your whole bowel movement, try to keep the breath flowing, nice, deep, relaxing breathings. Some people do really well with making noises, grunting, or certain low pitched voices can help relax the pelvic floor muscles. And we do not want to be straining on the toilet. Okay. All right. So getting towards the end here. So exercise stress management is a huge piece of constipation. So daily exercise has been shown to increase bowel movement. So if you are feeling constipated, maybe going just for like a 15, 20-minute walk or even a 5-minute walk can be helpful to stimulate your bowels, or maybe even some more extensive exercise. So another big thing that people are like, I'm eating good food, I'm drinking a lot of water. Like, what the heck is going on? I don't know why I'm so constipated. I want you to evaluate your stress and emotional health. This is really important, not because like it is a mental thing here. This is not what I'm saying. What I'm saying is that we have a really important system in our body and your central nervous system of these autonomic systems. One is called your fight or flight system. A lot of us have heard of that. And another one is your rest and digest. The fight and flight is called your sympathetic nervous system. The rest and digest is called your parasympathetic nervous system. And these are happening autonomically under our subconscious control day in and day out. Now, fight or flight is meant for a dangerous situation, like a bear is coming to eat you, you fight or flight. And then rest and digest is what we should be functioning a lot of times. But honestly, in American society, a lot of us are functioning in this sort of low grade stress, fight or flight situation. Now, when our body is in this fight or flight situation, our bowel and our GI system it's what's called inhibited. It is basically put on hold. Because if you think about it, in just like a truly think about more like an instinctual thing, if a bear is coming to eat you, your body's priority is not to go poop. Your body's priority is to survive. So these are really innate instincts in our body. So those systems really slow down. So what can happen in like modern times, not a bear, if we have, even if it's not a negative stress, just a lot on our plates, a lot of things that we're managing, our fight or flight system can actually be sort of upregulated or kind of actually occurring, which then slows down your gut and your transit time. So what we want to do, we want to encourage the rest and digest part of our nervous system. So what is that part? That is where our GI system is moving. All of our systems are kind of functioning a little bit more in the proper state versus a fight or flight. So how can we get ourselves into that rest and digest? Try to do deep diaphragmatic breathing, maybe go for walks, do things that bring you joy, happiness, time management to help your stress schedule. Obviously, we all have stress and things in our life. We can't just say, whoa, get rid of it. But I really want you to plug in time to do things that de-stress you, that fill you up, that make you feel good. That is super related to your constipation if you're having it. So if this is you, I want you to check in with yourself, be honest with yourself. Like, actually, am I low key stressed? I might not feel it, but maybe subconsciously I actually have a lot going on. Let me make sure I take a bubble bath or I do some things for me to help really encourage that rest and digest system so that we can say, yes, body, it's safe to have a bowel movement. Let me go ahead and feel the urge, etc. So I hope that makes sense as far as how some of our emotional stress can actually physically manifest. Okay, so that's kind of what, from a pelvic floor standpoint, in a general kind of webinar way that I can tell you what we can do to help for constipation. So let's kind of just briefly review. You can use your reflexes. So try to go poop in the morning or after meals. That's when your gastrocolic reflex is the highest. You can do that colon massage that we talked about, where you massage around. Just as a brief review, you start on the right side, do clockwise circles all around your colon. You can YouTube this if you want. Also really nice for babies if you have a baby. Also helpful for gas, right? Also creating that bowel routine. So in the morning, drink something warm, eat something. 20 to 30 minutes later, try to go have a bowel movement. If you don't have one in 10 minutes, don't worry, get up, do it the next day, over and over time. Exercise regularly, keep your meals regular if you can. Make sure you're getting in a good balance of water and fiber. Try to reduce stress. Also check your posture, your pooping posture. Some people will say blow when you go, so that can kind of help remind you, like gently blow out when you go to help make sure that you're not holding your breath and straining. Okay. I think that's it. We kind of zoomed through that. Nope, no pun intended. We're on Zoom. But now I'm going to kind of open it up for some questions. If you have any, we'll do the best that I can without evaluating you myself. I'll see if I can answer any of your questions if you have any. And if not, no worries. I also recorded this and I will be uploading it to our YouTube channel. If you know anyone who this is like speaking their language to, you can go ahead and send them this way. I'll be posting it on our Instagram and Facebook too, where there's a link to that. Kim, that's a good question. So she asked, is there a type of exercise that we recommend, like cardio versus yoga? No, not technically from the research. Really, the research supports walking is one of the best things, but it depends on your situation. I would say if you are more, depending on if you feel more relaxed after a cardio or a yoga class, whatever makes you feel really good, I would say that would be my choice, but one hasn't been shown to be more effective than the other. A really good question. Do what works for you. Do what makes you feel good. Any other questions? Yeah, you're welcome. I'm gonna just leave it up for a few more minutes, and I'll tell you a little bit too. We will be doing these webinars for February coming up. The next webinar is going to be, we're going to do all about urgencies. I'm going to do them every 2 weeks. We'll do a free webinar, so you're welcome to join that as well. So we're going to do all things urgencies next month, and we'll revisit the constipation webinar in a few months as well. So kind of try to keep things blocked and chunked together. So if you can't join, I know it's hard to join this dinner time. I really appreciate you guys joining. Oh, thanks, Marley. Thanks for joining. Thank you, Carla. Yeah, pass along. Happy to help. And if anyone has questions, feel free to message me. I love helping. Even if I can't help them personally, I will help get them to the person that can. Yes. So for appointments, you can either message me directly or you can also visit my website. You can do an inquiry on there. It's rhythm, P as in Paul, H as in Harry.com. So rhythmph.com. There's a thing there, or you can just message me directly and we can talk about getting you set up for an appointment because this definitely, if this is you, I would really highly suggest getting a personal evaluation so that this is not just general information. We can really dive into what's actually going on with your specific situation. So thank you. That's the best way as far as for appointment. All right. Well, I think that takes us through tonight. Thank you guys so much again for joining. Really appreciated having you on here. And the webinars are going to be every other week. So bi-monthly or week, I forget every time how I say that, but every other week we'll be doing the webinars and I'll be posting them the week before so that you can join and I'll send you the Zoom link. Thank you for asking that. All right, so any more questions, just send my way on Instagram, Facebook, email. You can do email here, I'll write it in here. It's Catherine@rhythmph.com. Send me a message, pass that along to anyone that might need help. This is what we love to do and we do day in and day out. I hope everyone has a great evening. Thank you so much again.